What if your body has been trying to warn you this whole time, and you didn't even notice? Not the obvious alarms like pain or injury. I'm talking about quiet, almost invisible signals your body sends every day that most people shrug off as stress, aging, or just a bad day. Your body never goes from perfectly healthy to seriously unwell overnight. It whispers first. Small changes in energy, appetite, breathing, digestion, even the way you think. These are the kinds of subtle clues that show up long before anything dramatic happens. Most people ignore them, thinking they'll pass, when in reality, these could be early warnings of something far deeper. It is time to start listening to what your body is actually saying. Now, think about this for a second. How many times have you felt something just a little off in your body, only to tell yourself it would go away on its own, or that you were just too busy to care? That's exactly how small problems become big ones, because many health conditions develop silently, and by the time the symptoms are obvious, it's often much harder to treat. So, in this video, I'm going to walk you through 7 silent signs your body may be in serious danger. Warnings that show up early, quietly, and without pain, yet reveal a lot about what's really happening inside you. And right now, some of these might be happening to you, without you realizing they matter. Stick with me until the end, because the final signs most people overlook completely, and they could be the ones that make all the difference early on. Now, the first silent sign we're going to talk about is something most people actually celebrate. And that's exactly why it's dangerous: losing weight. Because on the surface, it feels like a win. You look in the mirror, your clothes fit better, the number on the scale drops, and your first thought is, this is a good thing. But here's what most people don't realize. When weight loss happens without effort, your body is not rewarding you. It's warning you. Let me explain what I mean by that. Unexplained weight loss is when your body starts dropping pounds without any intentional change. No new diet, no increased exercise, no calorie restriction. Not yet, the scale keeps going down. And medically, even a loss of about 5% of your body weight over a few months without trying is considered a red flag. Now, pause for a second and think about this. Has that ever happened to you? Clothes getting looser, but you didn't really change anything. Because here's the part most people completely overlook. Your body does not lose weight randomly, ever. There is always a reason. And sometimes, that reason is hidden beneath the surface. It could be something relatively manageable, like hormonal imbalances, thyroid issues, or metabolic changes. But in other cases, it can be something more serious. Conditions that affect how your body absorbs nutrients, or even illnesses that increase how much energy your body burns without you realizing it. And this is where people make a critical mistake. They wait. They assume, I feel fine, so it must be fine. But here's the truth. Your body often shows signs before you feel symptoms. Weight loss can be one of the earliest clues, long before pain, fatigue, or anything obvious shows up. So, if you notice your weight dropping without a clear reason and it keeps going, don't just brush it off as luck. That's the moment to stop and ask, why is this happening? Because catching the cause early can make all the difference. And stick with me here, because the next sign we're about to talk about is even easier to ignore. Something people experience all the time and rarely take seriously. But when it doesn't go away, it can mean something much deeper is going on. And now, not all warning signs come with pain. Some show up as something so common that people ignore it completely. A fever that just won't go away. At first, it doesn't seem like a big deal. You feel a little warm, maybe slightly off, and you think it's probably nothing. It'll pass. And most of the time, that's true. But here's where it gets dangerous. When a fever lingers, even a mild one, your body may be dealing with something it hasn't been able to resolve. Let me explain. A fever is your body's natural defense system. It raises your temperature to fight off infections. That's normal. That's healthy. But here's what most people don't realize. A fever is supposed to go away. So when it doesn't, when it quietly sticks around for days or even over a week, that's no longer just your body doing its job. That's your body struggling to finish the job. Now, pause for a second and think about this. Have you ever felt slightly warm, slightly tired, just a bit off, but not sick enough to worry? That's exactly how this sign hides. Because a persistent fever doesn't always hit you hard. It doesn't always come with chills or severe symptoms. Sometimes it's just a low-grade temperature that keeps showing up, day after day, and you slowly start ignoring it. But behind the scenes, something else may be going on. It could be a lingering infection your body hasn't cleared. It could be inflammation building quietly. In some cases, it may even be linked to deeper conditions affecting your immune system or metabolism. And this is where most people make a critical mistake. They wait for it to get worse. They think, if it was serious, I'd feel worse. But that's not always how the body works. Sometimes the earliest signs are the quietest ones. So if you notice a fever that doesn't improve after several days, especially without a clear reason like a cold or flu, that's your moment to pay attention, not delay. Catching the cause early is always easier. And stick with me here, because the next sign we're about to talk about is something even more subtle. Something people often blame on getting older or being out of shape, when in reality, it can be a much bigger warning than they realize. Let's move on to a symptom that most people underestimate until it starts affecting their daily life. Shortness of breath. Because here's the thing, breathing is supposed to be effortless. You don't think about it. You don't notice it. It just happens. So the moment you do notice your breathing, something has already changed. And that's where this becomes dangerous. Now, yes, getting out of breath after a workout or running upstairs, that's normal. But here's what most people ignore. When simple, everyday activities start leaving you breathless, that's not fitness, that's a signal. Let me ask you something. Have you ever walked a short distance, climbed a few steps, and suddenly felt like you needed to stop and catch your breath, even though you shouldn't have to? That moment right there, that's where this sign begins. Because what you're feeling isn't just tiredness. It's what doctors call dyspnea, the sensation that you're not getting enough air even when you're breathing. And here's the part most people don't realize. Your body doesn't struggle for air without a reason. Behind the scenes, your heart and lungs are constantly working together, delivering oxygen and removing carbon dioxide. And when something interferes with that process, even slightly, your brain picks up on it. That's when you feel it. That tightness, that effort, that subtle sense of something isn't right. And here's where it gets serious. Shortness of breath can develop slowly, so slowly that people start adjusting their life around it without realizing it. They take the stairs less, they walk slower, they avoid exertion. They adapt instead of questioning it. But that gradual change can be linked to underlying conditions ranging from lung issues like asthma or chronic disease to heart problems, anemia, or even anxiety-related responses. And this is where most people make a critical mistake. They blame it on age. They blame it on being out of shape, and they move on. But here's the truth. If your breathing has changed, your body is trying to tell you something. Especially if it's happening during activities that used to feel easy, or if it comes with things like chest tightness, dizziness, or unusual fatigue. That's not something to ignore. That's something to investigate. Because the earlier you understand what's causing it, the easier it is to deal with.